I'm going to review the evidence of the health benefits of nuts.
This study from the New England Journal of Medicine in 1993 randomized patients to eat a diet without walnuts or a diet supplemented with walnuts. Except for walnuts, the diets were otherwise the same in nutrients and calories. Cholesterol levels were then measured and compared. The walnut group had lower total cholesterol levels, lower LDL, which is bad cholesterol, and improved HDL, which is good cholesterol. The drop in LDL cholesterol was about 16%, which is a lot for a dietary impact on cholesterol. So walnuts lower cholesterol, and this study has been repeated. And other nuts have been studied. Pecans, in this case, same result, a lowering of cholesterol. Pistachios, in this study, same result. And macadamia nuts, in this study, same result. And almonds, in this study, same result. All these studies have been repeated several times with tighter randomized controls. And meta-analysis of all these trials definitely proved the finding that tree nuts lower cholesterol, and they're all about equal in cholesterol lowering. And the more you eat, the lower the serum cholesterol. And nuts have another effect on cholesterol. The Predimed study from 2013 noted increased LDL cholesterol particle size in the group consuming nuts, suggesting a novel cardiometabolic mechanism by which nuts may decrease cardiovascular disease risk. And bigger is better, even in the world of cholesterol particles.
Nuts also reduce other cardiometabolic risk factors, including blood sugar levels, insulin resistance, and insulin secretion.
This Chinese study of diabetics randomly assigned either a normal diet or the same diet augmented with almonds. After weeks, lab tests were checked, then the two groups switched diets. That is, the people eating the control diet switched to the almond diet, and the people eating the almond diet switched to the control diet. In addition to lower cholesterol, the almond diet had improved blood sugars, lower insulin levels, and improved insulin resistance. Benefits are not restricted to people with diabetes. This similar study showed that people at risk for diabetes that were assigned to eat the almond diet had lower blood sugars after meals. And another study in normal, healthy people without diabetes showed a reduction in insulin need as measured by insulin secretion in the group that consumed the almond diet.
And that's not all. Nuts may also be an important food group for battling obesity.
These cross-sectional studies show an inverse relationship between nut consumption and body mass index. People that eat more nuts are not as fat. These types of studies don't prove that nuts help prevent obesity. They just note that nut eaters are less likely to be obese. So next, let's look at randomized trials. Multiple trials have randomly assigned people to either a diet high in nuts or a diet without nuts. Then the two groups are compared. And the nut groups have lost either the same amount of weight or more weight than the control groups in all of these studies. Randomized trials are one of the best types of trials to prove an impact, so this data suggests that diets high in nuts help with weight loss. But all these randomized trials are short-term, just weeks to months. So with this data, we're only convinced that nuts help with short-term weight loss. To better assess long-term impact on weight, let's look at prospective cohort trials. Remember that with these types of trials, the researchers keep track of risk factors and follow the people over time. Then they compare people that have the same risk factors except for one risk factor that they want to study. In this case, nuts. This is an analysis from the Nurses' Health Study, which I previously reviewed in the Red Meat Talks. But this is different data on tree nuts instead of red meat. 50,000 women were followed for about 10 years. Women that ate nuts more than twice per week gained less weight than women that ate few nuts. And here's a study from Spain that followed about 10,000 people with the same results. Less risk of obesity in people that ate nuts 2 times per week. And this study followed 120,000 American women for years. The average woman gained weight over the years, except women that ate nuts lost weight. There are lots of scientific reasons why nuts may help control weight. I think the beneficial metabolic effects I previously covered on insulin and blood sugar are likely to be one of the most significant reasons that nuts help with weight control. Regardless of the reason, we have cross-sectional studies, short-term randomized trials, and prospective cohort trials that all suggest that frequent nut consumption helps with weight control.
But that's not all. Nuts also reduce inflammatory markers like C-reactive protein and homocysteine. Yes, this is starting to sound like an infomercial, but that's because there's just that much goodness in nuts. I'm not going to review the data on these inflammatory markers, but there are secondary cardiovascular risk factors that are improved by eating nuts.
How do nuts do this? We don't know how, There are a lot of active phytochemicals in nuts. There are a lot of polyphenols and even more sterols, stanols, and steryl esters. We don't really know which of these phytochemicals is most important for improving health. All we know is that there is a lot of goodness in nuts. And quite frankly, who cares about the biochemical science? The overall health outcomes are what matter.
Since nuts lower cholesterol, improve blood sugar, reduce the risk of obesity, and improve cardiovascular inflammatory markers, you'd expect them to prevent heart disease. Let's look at the data from prospective cohort trials.
Published in 2002, this is data from 20,000 physicians that were followed for 17 years. Those that consumed nuts 2 or more times per week had a reduction in sudden cardiac death by 50%. 50%! And a 30% reduction in death from coronary heart disease. About 15 years later, the same group was studied again, this time with more careful adjustment for other risk factors, with the same result for reduction in death from cardiovascular disease. There are a lot more prospective cohort trials, not quite as many as we assessed for red meat, because some of the cohorts didn't adequately track nut consumption, but all told, we have more than 600,000 people followed for many years. In these studies, the people eating nuts had a lower risk of heart disease and death from heart disease, and in this last study, even a 56% lower risk of death from any cause. Yes, that's 56%. Why do we see such different numbers for each study? Because there are different populations of people followed for different amounts of time, and they consume different amounts of nuts. We don't have a meta-analysis that pools all the studies together yet, but it doesn't matter because all of the studies show a benefit from nut consumption, and it's a very large benefit. The data is convincing that nuts reduce heart disease. I'm going to go over one last study, the Global Burden of Disease study. This is a cool study. It was a ginormous undertaking. A cast of thousands worked on this project. Because it's so large, the last time the global burden of disease was assessed was in 1990, and then not again until 2010. Dozens of socio-environmental factors were assessed to determine which factors cause the most disease worldwide. Factors include exercise, smoking, pollution, access to clean water, etc., and also include various food types. The researchers analyzed thousands of studies, then applied a lot of geeky math. Their findings: diets low in nuts were the #1 most important dietary factor in the worldwide burden of heart disease. Yes, nuts are the #1 most important dietary factor for heart disease worldwide. It was #3 amongst dietary factors on the all-cause list of disease and death. And compare the impact of diets low in nuts to smoking. By their calculations, a diet low in nuts is more important than smoking in causing heart disease worldwide. This does not mean that a diet low in nuts is more dangerous than smoking. This means that worldwide, more heart disease is caused by a diet low in nuts than smoking. Smoking is more dangerous, but the majority of the world knows that it's dumb to smoke, so few people smoke. On the other hand, very few people eat nuts regularly. The great majority of people are not eating enough nuts, hence the greater overall impact on heart disease. As a population, the #1 dietary change that we can make to reduce heart disease is to eat more nuts. That's more important for heart disease prevention than any other dietary factor.
How often should you eat nuts? Well, we know that the more nuts you eat, the lower your cholesterol. We also know from cohort trials that eating nuts at least twice per week lowers mortality. I therefore recommend that you eat nuts at least 2 times per week, but ideally every day.
How much should you eat? I suggest about 1/4 cup, which is a small handful. Where do nuts fit on our healthful scale of foods? Right at the top. Nuts have a legitimate claim to being one of the healthiest foods we eat. If you eat foods that are on the bad for you side of this scale, consider replacing them with nuts. Actually, there's a group of researchers that suggest mixing beef with nuts, so the combined almond burger will fall in the middle from a health perspective. I'm not going to review that data though, because I think the researchers are nut burgers themselves. Note that I didn't mention peanuts during this talk. That's because peanuts aren't tree nuts, they're legumes. They're still good for you. They'll be placed approximately here, but I'll remove them for now because we'll cover peanuts when we cover legumes. Nuts are truly a superfood and should be a frequently consumed food group. Tree nuts lower cholesterol, help with weight control, improve blood sugar and insulin levels, and very significantly reduce heart disease.